It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: hip dysplasia in dogs, symptoms, causes, treatments. Hip dysplasia in dogs occurs when the ball and socket joint of the hips does not develop properly, which can lead to lameness and painful arthritis. In fact, hip dysplasia is the leading cause of hind leg lameness in dogs, especially in large breeds such as Newfoundlands, St. Bernards, and German Shepherds. It is estimated that between 20 and 40% of large breed dogs suffer from this disease. This genetic condition can appear from birth, leaving some very young dogs lame. For others, it's a long road to decreasing mobility, as the deformed hip joint causes the bones to rub and grind rather than glide smoothly. But for many dogs, there are ways to treat, prevent, or at least lessen the impact of hip dysplasia. 1. Symptoms of hip dysplasia in dogs. In dogs born with hip dysplasia, hip development may appear normal at first. However, the first sign of a problem usually arises when the dog is between 4 months and 1 year old. Dogs may begin to show signs of hip pain when walking or running. Your gait may change. They may have difficulty standing up, and when you press on their butt, you may see their pelvis drop. Due to abnormal wear and tear of the hip joint, the condition can progressively deteriorate as the dog's skeletal system fully develops. In the worst case, it can prevent the dog from walking. They may resist physical activity, suffer from hind limb lameness that may be intermittent or persistent, or have an unusual posture. Over time, you can lose muscle mass in your thighs. The shoulder muscles may enlarge as the dog transfers its weight to the front legs. 2. Causes of hip dysplasia in dogs. This is an inherited bone and joint disorder that causes abnormal development of the hip joint, although environmental factors also contribute to the development and progression of the condition. Large and giant breed dogs are especially genetically predisposed to developing hip dysplasia. The design, structure, and functionality of the hip in dogs is surprisingly similar to that of a human. In both, the hip is a ball and socket joint. In a normal hip, the smooth, rounded head of the femur fits deeply and comfortably into the acetabulum. Durable ligaments allow a wide range of motion and hold the joint together as a whole. In a dysplastic hip, the head of the femur is left loose or, depending on the severity of the condition, may be completely dislocated from its socket. The bone separating from the joint causes friction and, as the condition worsens, painful arthritis. Some factors that can affect the condition include weight gain, obesity, and poor diet. Excessive growth and exercise can also worsen the condition. 3. Veterinary treatments. It is difficult to outline a typical course of treatment for hip dysplasia in dogs, even after the condition has been diagnosed, because there is a wide range of possible severities of the problem. Treatments range from modified diet and exercise routines to surgical procedures such as hip replacements, which, as you can imagine, are highly invasive and require long recovery times. However, in some puppies, early surgery can help prevent degenerative joint disease. And for dogs older than 9 months, new advances in total hip replacement, replacing the old joint with a new artificial one, have led to extraordinary recoveries in up to 95% of cases. In a less severe case, your veterinarian may prescribe anti-inflammatory medications and perhaps the use of Odequan, a drug that can relieve pain and inflammation and help repair damaged cartilage. They may also recommend restricting exercise, avoiding walking on hard surfaces, losing weight to reduce stress on joints, and physical therapy. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.